All right, and we're joined today by Marc Wittmann. Marc Wittmann is a research fellow at the Institute for Frontier Areas in Psychology and Mental Health in Freiburg, Germany. He studied psychology and philosophy at universities of Freiburg, Switzerland, and Munich, Germany. Received his PhD at the Institute of Medical Psychology, University of Munich. From 2000 to 2004, he was head of the Generation Research Program, Bad Tolz, University of Munich. Between 2004 and 2009, he was a research fellow in the Department of Psychiatry at the University of California, San Diego. His research focuses on time perception as an indicator of cognitive functioning and emotion, and on the effects of age and psychopharmacological treatment, chronic drug abuse, and brain injury on the experiences of time. And he's the author of the MIT Press books Felt Time, The Psychology of How We Perceive Time in 2016, and Altered States of Consciousness, Experiences Out of Time and Self in 2018. So he is exactly the kind of speaker that would be perfectly suited to this journal club. We are looking forward to hearing what you've got to say. I'll turn the floor over to Marc.
Oh, this should have worked. Okay. Well, thank you, Jonathan, for the invitation, for the presentation of who I am, and Efi and Arji for the invitation and the correspondence beforehand. And I'm happy to be here in front of the expert crowd, time perception researchers, and I hope we can get into a very nice and maybe lively discussion on what I want to present today. It's all about embodied time, how the brain and body process time. And I used to start my talks with this first phrase here, 10 researchers, 11 models, and talking about the diversity of time perception models we have in our field, as contrary to other fields like space perception, where there's quite a good consensus on how the brain processes time. But maybe, this is my first talk, after these game-changing two meta-analyses, perhaps, which I would want to start talking about at the beginning, with all the available around 100 fMRI studies on time perception, where only two brain areas remain as the main hubs for the processing of time, pre-SMA or SMA plus the insula. I will talk about that. But then I will focus on the embodied time and talk about the current, but also historic evidence on the question, or actually my thesis, that the body signals inform us about the passage of time. And then at the end, we should have still got some time at the end to talk about variations of conscious states, so the varieties of conscious state, which inform us a lot about how time and the self and the bodily self basically are up and down modulated in different altered states of consciousness. I will present my own research on flotation rest, research on meditation, and a bit on psychedelics. So first, a preliminary slide, classic. So we should always be aware, if we're talking about time perception, that we are talking about different, totally different, maybe even tasks, if we're doing it in the lab. And one is, it's about temporal processes of the brain involved in the timing of actions. And that's all about event synchronization, which you see from the, let's say, 3 photos on the left, where it's all about the to be exact in the millisecond timing range to be able to hunt, to not step your dancing partner on the shoe, or to have a nice feeling of quartet music. That's one side of timing, the timing field. But the other one is that time is also an experience, an immediately felt experience, which could be key to understanding cognitive processes and emotional states. And also, while temporal processes, timing is more in the range of milliseconds to a few seconds, perhaps, this experience of time can span seconds, multiple seconds, minutes, and beyond. So this one preliminary discussion. Another preliminary slide is, so we could talk about two fields actually of time perception. And one is more about the retrospective time perspective and looking back, which is all about memory content or the amount of changing experiences. And from in everyday life, we know this from vacations, a lot of activities, and looking back, subjective time expands. But let's say everyday routine across your working day and subjective time seems shorter. And in the lab, how do we test that? Is that participants are not aware of a time perception task. Only after an interval has ended, we ask them about subjective time. So that's pure retrospective time perception. But I will talk more about, or nearly exclusively about, prospective time perspective. And that's experienced time at the present moment. And that's quite clear from a lot of psychological studies. It's all about attention to time or distraction from time. So if you attend to time, for example, when waiting, enjoying boredom, time passes slowly. But if you are distracted, have pleasurable activities, then time passes quickly. And in the lab, how do we test that? Is that the participant is made aware before the task that he has or she has to judge time or duration. So in 2009, together with Virginie van Wassenhoef, we had this special issue in the Philosophical Transactions of the Royal Society B, where we tried to gather leading researchers on neuroscience, cognitive neuroscience of time. And what we found here was basically that so many different functional principles were discussed. Not necessarily all these people were part of this special issue, but still which functional principles and which brain locations were discussed. I just listed them here, and I won't go into the details. You can read them yourself. My take-home message here is, for example, if you look at the brain locations, you probably can put if you look at the individual brain locations, you can put together a whole brain of all these different brain areas that have been named to be principally involved in time perception. So there's no agreement on processing models and no agreement on neural substrates in 2009. So there was it's back a while, 15 years now. And so this is how I analyze normally where are the sources of difficulty in localizing brain areas for a sense of time. And that is because there are several patient populations impaired in time perception, with patients with cerebellar lesions, with right hemisphere lesions. Also, patients with Parkinson's disease can have quite profound disorders in timing. But, and that's also important, impairment does not mean breakdown in performance. So they still can time and perceive time and give judgments of duration, but they're impaired versus or compared to a control group. Then you have different effects of transmitter systems. Dopamine is much involved. Serotonin can be involved, but also GABA concentration levels have also been shown to be involved in time perception. And then last but not least, there's this disruption of several brain areas through TMS, which transiently impair time. But this could happen to TMS to the frontal cortex. Also, it has been done to the cerebellum. And so a lot of brain areas are affected, plus the transmitter systems. And then neuroimaging studies, I just show you one very nice neuroimaging study from 2003 as a very early neuroimaging study, and related to a control condition, which was a good control condition, I think, if I remember correctly. You see all this list of brain areas, which showed active for the time versus, in this case, I think, space discrimination tasks. Now, of course, you can say you could do some easy or some cherry picking on deciding for yourself which brain area to select. You can imagine I would select the insula. So then 2003 and 2004, we have these two meta-analyses, which included all the available studies and experiments in neuroimaging on time perception. This is the first in the Neuropsychological Review, a team from Iran, France, and Germany. Together, Jennifer Cole, it probably will be known by most of you, was one of the authors. And then we have Martin Wiener, who's here, with Chloe Mondock. They showed basically in their overviews that it is mainly only two areas of the brain remain as the most important brain regions for timing and time perception. That's the supplementary motor area and the bilateral insula. Plus, importantly, also the insula was the only region in the brain which was active across all time scales from the milliseconds to multiple second ranges. If we look at these two meta-analyses separately, they use this activation likelihood estimation method, which identified activation foci across these different neuroimaging studies with a significantly higher probability than chance. And in the first analysis, this Iran, France, Germany group, cooperation looked at this 97 independent experimental contrasts. So from the neuroimaging studies, looking at the contrast, timing versus control. And then they found out that basically it's insular and pre-SMA that is activated. Two sole brain regions. Then they did a second analysis where they only looked at those studies or experiments where the timing conditions had a strict control condition, a very strict control condition, which they then defined, which was matched for task structure, working memory, attentional demands, and overall difficulty. And then what remained was the left anterior insular and pre-SMA. And in this case, only the left insular cortex was the only brain region then activated for all duration ranges. The second study by Chloe Mondock and Martin Wiener was again this ALE method. In this case, the degree to which activations in timing studies were specific for time perception, so a slightly different method rather than generally associated with other cognitive functions. What they did they do? So they compared the ALE maps from 114 explicit timing studies with another ALE map on a set of, just imagine that, nearly 10,000 fMRI studies assessing a range of tasks other than timing. And then their results were relatively more activated for timing than other cognitive functions were bilateral, anterior-insular, and the left SMA. So the SMA and pre-SMA findings are, I think, not so surprising because for 10, 15 years, the SMA was always prominently represented in time perception, especially timing research. And if you look at the literature, it shows that the pre-SMA is for the selection inhibition of actions related to external stimulation, and it's correlated with sensory and suprasecond timing. The SMA proper is related to voluntary motor behavior, but also including the precise timing of actions. And Jennifer Cole and Sylvie Droivelet had a nice subtitle of their summary paper, When to Act and Not to Act. So also showing the timing, precise timing, or the inhibition of acting, important. But then again, pre-SMA more suprasecond timing, SMA subsecond timing. Importantly, SMA and insula are anatomically and functionally connected. So there may be then the two core neuroanatomical regions for time perception, also in a certain interplay, which is not very clearly defined yet, but that's a work for future studies. If you use more philosophical terms, you could say that SMA is there for inactive timing of movement, through bodily interactions with an extended environment. And the insula is there for embodied time experience across clock time, across physical time, if you want. So I will, in the following, focus on the insular cortex studies, which I conducted myself partly with other colleagues and were more expert than SMA. And since SMA is actually already on the radar screen of all timing and time perception researchers, but I want to make a case for the insular and also explain how could you interpret this insular activation. So first of all, also relating to Bud Craig's essential work, the insular cortex is the primary interoceptive area, so meaning it represents the physiological conditions of the body. So thirst, hunger, temperature, pain, these are all come up through the representation of signals from the body. But also emotion is an important part here. If you think about Damasio's somatic marker hypothesis, that the interpretation of physiological states also creates our subjective emotional states. And there are a lot of neuroimaging and lesion studies showing how physiological needs are related to insular cortex activity, emotions, of course, but also such things as complex decision-making, where we have this pro-verbal gut feeling to make your decision. In music perception, if you think about temporal structure, emotions, but also in meditative states, where we're talking about the concentration on the bodily self, which is important. So that's the insular cortex background, the primary interoceptive area of the brain. And in this 2009 philosophical transactions issue, there was also an article about Craig, who basically, I think for the first time theoretically argued made the case that the insula is the most important hub for our subjective sense of time. So I recommend reading this article. In the following, I will now talk about the empirical evidence. I will not talk about everything that I list here, but most of it. And I will talk about my own research on insular activation during time perception regarding multiple second timing. There's also, by Domenica Boetti, there's also a neuroimaging study on very short time intervals, around 1,000 milliseconds, 1 second. So that's also worth looking into it. Then I'll talk about work by Alice Tekhil, where she showed that subjective interoceptive awareness predicts timing accuracy. She also showed that fMRI resting state connectivity with the posterior insula correlated with not only subjective interoceptive awareness, but also it predicted timing accuracy. Then we have lesion studies. I won't go into this, but I recommend reading those. Timing impairments in patients with lesions, mainly to the right insular cortex, are there. They're available. And then insula, but now going a step more into the body. I show results on how the heart rate predicts subjective duration of several seconds time ranges, but also in the millisecond time range. And then finally, the heart rate evoked potential also has been shown to predict timing. And I will show our own work, which was led by Shiva Koshnod. So this is the temporal reproduction study. I'll actually show this in more detail because over and over, several studies I will refer to will have very similar uses a very similar task. And this was the 2010 paper, the first time I showed it empirically, how the insula is related to time perception. And what we have is first an encoding phase, where people have to listen to a tone with a certain duration, then there's a pause, then comes a second tone. And the second tone has to be stopped when people think, oh, the second tone is now as long as the first tone. So classic duration reproduction task. We also had a little task on memory task so that people would be more refrain from counting, to stop counting. And we had a control reaction time task. So we could basically look at all the contrast between, you see here, encoding reproduction or encoding control, reproduction phase, control phase, so red versus green versus blue. All this contrast could be done. So the first one, just looking at the activation contrast. This is just one example from the encoding versus control phase. Question on where in the brain something is happening. What you see actually here for the 3, 9, and 18 seconds, very similar to the former neuroimaging study I showed to you. A lot of different areas show up to be significantly more activated than the control phase. But the good thing was here, because we had these long durations with 9 seconds and 18 seconds, we could actually look at time activity curves, because we have this TR, the repetition time of 2 seconds, and we could look in the regions of interest during encoding and reproduction phase, how activity develops. And that brought me to this insular activity interpretation. So here's the encoding phase, 9 seconds. And what you see is mainly in the posterior insula, a little bit superior temporal areas, but mainly posterior insula, an increase in activation, which stops around the end of the presentation interval. This is for 9 seconds. Here we have it for 18 seconds. Again, an increase of activity across time, which ends at the end of the encoding phase. Then the reproduction phase, so when they have to hit the button. And there we showed anteroinsular left, right, and also here SMA actually around 10 seconds before the button press, this increase in activation, which shortly before the button press goes down. That was for the 9 seconds, a little bit more messy in the 18 seconds time range. You have again right and left anteroinsular, and the little medial frontal also showed a similar behavior. So what we showed now in this 2010 article, that during the encoding phase, which you could say is there for the buildup of duration representation, it's posterior insular activity mainly. And in the reproduction phase, where we have this temporal comparison between the encoding phase, which you had just listened to, and now to compare with the reproduction tone before pressing the button, it's anteroinsular activation. So these were the very first study showing this insular activity in 2011. We had we reproduced these findings with even more subjects, and it will become even clearer that it's only posterior and anterior insula. What I want to show now is a different method, which has been introduced by Alicia Tekel and her colleagues from University of Rome. And she has a very similar, similar duration reproduction task used, especially also related to the durations used. But she had 2 conditions, and that was some the clue, with irregularly presented acoustic cues, which were interspersed coming at times not to be predicted, or regularly presented acoustic cues, which came at certain intervals and which you could use as a cue for timing. And only the condition with irregularly presented acoustic cues basically was predicted by the amount of individual interoceptive self-awareness. So that's, I showed this later. This is a questionnaire on interoceptive self-awareness of everyday life, how you feel your bodily self. And so more interoceptive self-awareness, the more exact in the timing of accuracy of duration reproduction, but only in the irregular condition, not in the irregular condition, when you can use the external signals as timing cues. Then one step further, what this working group led by Alicia Tekel did was, so he showed the resting state connectivity of the posterior insula. So with 2 areas, putamen and precentral gyrus, was correlated with the timing accuracy only in the irregular cue condition and not in the regular cue condition. And that was then again modulated by individual everyday interoceptive awareness. So here is the brain connectivity with posterior insula basically points again to maybe something, an underlying interoceptive process, especially in correlation with this interoceptive awareness questionnaire. So this I did with Karin Meissner, another study. So look again the same, or keep in mind the same duration reproduction task I showed beforehand with the fMRI study. Now we use with electrophysiology, and they looked at the cardiac beats. And what you see here on the right, you see the black dots is the encoding phase, and you see the cardiac interbeat intervals get longer and longer, so the heartbeat gets slower and slower. The black dots are the encoding phase, the gray dots are the reproduction phase. And what we show here is that the heartbeat slows down during interval timing in both phases. And the linear trend correlated positively with duration reproduction performance, meaning the steeper the slope, the longer the reproduced duration. I was again these long time intervals. But now going down to millisecond timing, so below 400 milliseconds, and in one case even 100 milliseconds, the work by Saideh Sadeghi and by Irina Arslanova, actually nicely synchronistic. At the same time, these two studies were conducted. And what Saideh showed that the pre-stimulus, when the pre-stimulus heart rate was measured, was lower, so relaxation response, then the subjective duration was relatively expanded. And what Irina Arslanova showed was when the stimulus to be timed was presented at the diastole, which is the relaxed state of the heart, again, duration was relatively expanded subjectively. So you could say body states basically determine subjective duration in the milliseconds time range. And now to the work led by Shiva Koshnod, which we last summer we published. And again, our duration reproduction paradigm I already showed you a couple of times. And now what we did was with EEG cap on, people did this duration reproduction task with 3 different intervals. And we measured the heart rate plus the heart rate evoked potential amplitude. And on the left side, the pink lines, what you see for the 3 different intervals, getting longer when you go down in the list. You show the second by second development of this amplitude of the HEP amplitude. And on the right, you see the correlations, the average change of the heart rate evoked potential amplitude between the first and the last second. And that correlates negatively with the reproduced duration. So the 8-second and the 12-second intervals, meaning the larger the increase in the heart rate evoked potential, the larger the under reproduction of duration. In the same study, what we also looked at, so Alicia Tekel had shown that the self-awareness questionnaire of body self-awareness correlated behaviorally with the duration reproduction task, but also with the neuroimaging data. So we also used this, and we showed that everyday interoceptive awareness, according to this questionnaire, correlated positively with the accuracy in reproducing duration for the 4, 8, and 12 seconds intervals. So I just had a quick snapshot of this self-awareness questionnaire. The original is Italian, but it has been validated in English and German, so it can also be used, for example, in English. And you see, just to list, you see this everyday experiences of how you've experience your own body. And then there's a list of something around 20, 25 items. Okay, so one step further now, showing how emotions, the body, and time are related. Because what I showed here is comparably recent evidence or some sort of evidence individually dispersed among the literature. But what has been known for decades is, of course, how emotions and valence and arousal, how they influence subjective time. And so we're talking about hundreds of studies, several hundreds of studies showing this. And for example, short stimuli with emotional content are judged to last longer if they're high aroused stimuli and have negative valence. It's a lot of work by Sylvie Travollet and Giovanna Mioni and many others. Also emotional stimuli, that's work by, for example, Ruth Ogden, also Clemens Böllner, show that emotional stimuli, they elicit a physiological arousal response, heart rate, breathing rate, skin conductions, and this influences subjective time. Also, I think maybe pain is the most striking example, which we all can relate to. Yeah, stronger pain stimuli. For example, in one study, were lasted longer than weaker pain stimuli, and this correlated with the respective skin conductance levels. Yeah, that's a study from Ruth Ogden's lab. And then individuals with high body temperature, so fever, also overestimate time. So you see now all these different areas of expertise coming together maybe, and also being related to this insular activation. That's what I want to show. And we all know this classic pacemaker accumulator model. I don't want to go too much into the details, but this, let's say, cognitive construction of this model, yeah, with these pacemakers and accumulators, what maybe these pacemakers are actually the bodily states, and the accumulator is maybe in the insula. This would be this heuristic interpretation, or using this cognitive model and applying it to these findings. So you could say subjective expansion of duration is through attention to bodily states. Yeah, so it's not just attention to this these ticks of the pacemaker accumulator model, and increased bodily arousal in affective states again increases the pacemaker rate, again leading to an relative overestimation of time. And this fits very well, of course, to the phenomenology of Maurice Merleau-Ponty from 1945, yeah, who inserted in his philosophy a lot of neuropsychological work of his time related to embodied cognition, and he has a specific chapter on subjective time. But if you think, oh, this is all really new stuff, or at least the empirical side, yeah, there's one guy here who worked in Freiburg and published in 1889. Yeah, so that's 135 years ago in Freiburg. So that's where I'm just sitting right now. There we have this guy, Hugo Münsterberg, who was a scholar, a student of Wilhelm Wundt, and moved to William James in Harvard in 1892. And what did he do? A duration reproduction task. Yeah? In this case, with intervals between 6 and 60 seconds. And he showed then that temporal reproductions were most accurate when the onset and offset of the intervals coincided with the breathing in of the subjects. And this is his conclusion 135 years ago, which is an embodied cognition conclusion. Yeah? The sense of time relies on the sensation of tension of the different organs, which are caused by muscle contractions. Yeah? So this is already some sort of precursor of the embodiment idea for time perception. So what I want to do now, just before I go over to the question of altered states of consciousness and how self and time are modulated, just two slides, one on psychopathology and time. And I'm just doing this just as a teaser, if you want, because this will be a whole, let's say, talk in itself. And what one sees in many cases of psychopathology, for example, in depression, yeah, that people report or overestimate duration, they feel a slowing down of subjective time, or they feel that they're stuck in the present. And there are behavioral timing studies. I just have one here in the minutes range, but one has to be careful. There are quite mixed results there. So it's not so clear in timing-wise, behavioral-wise, but my reading of the literature is that if the duration is long enough, around the 1 minute, 1.5 minutes, then you find the results. But also in interviews on subjective time passage, that's David Vogel in the Vogelei group and from the University of Cologne. They did interviews with patients with depression, and they reported this being stuck in time, slowing down of subjective time. But you also find this in other areas of psychopathology, that drug-dependent patients or in general, I think that's important, that impulsivity as a symptom of psychiatric neurological syndromes also is related to an overestimation of time. And with Martin Paulus, we had a TICS review in 2008 on that. And if you want to go into a sketch of all the relevant literature, I think this is 5 years ago, you can look at this Frontiers in Psychology review, where they, for the first time, linked time processing, interoception, and insular activation in clinical disorders. So 4 different basically areas bringing together in this review. There, in some cases, there were not so many available studies, but they did a good job in sort of summarizing all the available evidence. And just because I always like historic digging, yeah, so here a very special kind of article from 1905. And this is a psychiatrist at the Saint Anne's Psychiatric Hospital in Paris. And he describes this female psychiatric patient, Alexandrine, and again showing how the body feelings, emotional feelings, and sense of time are all interconnected. In this case, having no senses at all, no sense at all of all these 3 faculties. So, for example, no sense of bodily feelings and urges. And the doctor did tests where she didn't show reactions to ice water in the ear, which is quite a mean thing to do. Needle pricks, she didn't respond very much. She had no emotional feelings. So she had physiological reactions to emotions like tears, but she didn't say she didn't have any feelings of when she was sad. And she had no sense of time. So she could have a cognitive control of time through newspapers, daylight clocks, but no subjective sense of duration. Seconds to hours range. And this doctor did actually, Dallon did actually some psychophysic tests with metronome speed. The Alexandrine had to compare metronome speed and was very bad in doing that. So there's even a psychophysical proof that she had no impaired sense of time. And this is a conclusion by Dallon. The duration perceived by consciousness is nothing less than visceral sensibility. We have something resembling internal clocks made up of various physical rhythms supplied by signals from our gut, bladder, lungs, arteries, and heart. Yeah, so I have another, I think we're okay in time. I just have another few slides where I'll just give you an idea on more psychological concepts of how self-consciousness, body consciousness, and time consciousness are related, and basically saying that the intensified awareness of the self relates to an intensified awareness of time. So in altered states of consciousness, that self and time are up and down modulated. So we have our 2 maybe prototypical situations in daily life. One is boredom and waiting time, where we have an intensively and negatively felt over-representation of time and self, which you see from this lady on the market. That's from the Wikipedia, actually, in entry on boredom. Or the other way around, the flow states, where you're so absorbed in an activity that we have an under-representation of time and self. So that's what the next slide where I show is partly an upregulation or partly an downregulation of the senses of self and time. And so we did a variety of studies on a real waiting time task of exactly 7.5 minutes. Why did we do this? Because we want to have people attend to time and have maybe increased arousal, because this was a real waiting time task. So what the experimenters always did, they came, and we had a cover story where people came into the lab and we said, oh, sorry, our computer has crashed. We have to reboot. Please, could you wait here in this room? And we took away cell phones, reading material, any reading material in this completely boring, non-stimulating room. And then we asked people later, so how long did you think you were in here? How did time pass for you? How did you feel related to boredom, etc.? So classic visual analog scales we used, and over we found that the more negative the effect, the more arousal, the more boredom, the more the more attention to time people had, and the slower subjective time passage. So this is the one side of the spectrum, waiting time, and really you feel yourself more strongly and time drags. Then the flow situation, if you look at, for example, in video games, in VR, which induce flow states, that's a study we conducted. And if you look at the components of the flow experience theoretically by Mihaly, it's all about an intense focus, concentration on the present moment, a loss of reflective self-consciousness, and a distortion of temporal experience. So that's what we're talking about. That's a definition of flow experience by Mihaly. And what we showed here, when people play this game Thumper, either on the screen or in VR, that the more flow experienced through a validated inventory, we assessed this, the faster time passed. So this is then waiting time versus flow, looking at these two opposing states. Now, the last few slides on altered states of consciousness, self and time. What you very often have at the beginning is an intensified self-experience, a slowing down of time. And then in peak states, you get into an ego dissolution or a dissolution of time. And I'll just quickly go through a few slides on meditation, psychedelics, and flotation rest. And what you can see is that in very experienced meditators, thousands of hours of meditation experience. So this is with Damisela Linares Gutierrez, who was my doctoral student. What she showed that people coming to our lab and meditating and then asking them with questions, visual unlock scales about their experience. And Sylvie Dravollet and Michael Dambrun from Clermont-Ferrand, they basically did this with interviews of these very experienced meditators. You have the people experience a faster passage of time, weaker body self boundaries, and these are experiences during peak states of meditation. On the other side, for example, if you look at experience of meditation sessions for novices, there time passes more slowly. You have an increased body awareness. What you induce in novices is more mindfulness, being in the present moment here and now for novices who cannot reach these peak states of meditation. So they're much more self-aware and time-aware. We did a study ourselves with Eric Pfeiffer as a lead author. And then there's a group near Rome, actually in Umbria, which also showed this with novice meditators. Psychedelics, I'm coming to the end. I know it's quite a tour de force. The Vollenweiler lab in the University of Zurich, they have conducted studies with hundreds of individuals, healthy participants. And what they show with questionnaires, there's always this item correlation of ego dissolution, dissolution of time, and a feeling of disembodiment. And if you look at the late Benny Shannon's work on time distortions in ayahuasca, so you see, if you look at the modified temporality, a lot of things can happen during the experiences with ayahuasca, but the peak experiences, again, meaning no time, no self. And now to our own research, we conducted, or Helena Ruby as a doctoral thesis, with flotation rest. So rest meaning restricted environmental stimulus technique. And here floating in water at body skin temperature, super saturated with Epsom salt, magnesium sulfate. And there you don't see anything, you don't hear anything. You lie in this comfortably warm floating basin, and there's no stimulation through external senses. And the initial experiences, again, an increased awareness of time through increased interoception, because there's just you and your body in there. You don't see anything, you don't hear anything. But later, during the float, you have this loss of sense of self and time, what I like to call instant meditation. Although you're not an experienced meditator, you get in a relaxation state and have a decreased mind wandering. And looking at this in an experimental design, 60 minutes flotation rest versus 16 minutes bed rest, a water bed essentially, where you're also in a room, it's dark, you don't hear anything, you're horizontal on this nice warm water bed, but there was much more time distortion in the flotation rest condition, and the body boundaries dissolved more strongly in the flotation rest condition. And these two variables correlated with an inventory on altered states of consciousness. So they actually showed that these are facets of altered states of consciousness: time distortion, body boundaries. Yeah, so that was it. So what is subjective time? I would say it's all about, when we're talking about momentary time, it's about the experienced self, about body time, insular time, emotional time, and time consciousness and self-consciousness are very much related. So I refer to my colleagues during the talk on the slides, and here are the sponsors of my research I want to highlight, but here's just a little idea I had just to sketch it. Maybe we have something like parallel neural systems for processing of time on a self-awareness continuum. So if self-awareness is lowest, for example, in flow, absorption, yeah, maybe more sensory motor processing happen, SMA. But if self-awareness is highest, yeah, internal focus, no external cues, just as in mindfulness, boredom, then insula and interoception are more involved. And that's it. Thank you for listening.
Thank you, Mark.